KPIX5's reporter Andria Borba is live in San Francisco, where people are already taking the recommendation very seriously. Andria?
Well, Elizabeth, if you go neighborhood by neighborhood, some neighborhoods like Chinatown have been wearing masks in public for quite some time. Here in the Marina, it is a new thing starting yesterday with those recommendations from the state of California. After weeks of a choir of public health officials preaching about keeping 6 feet of physical distance, now a new recommendation: cloth face masks when you're outside.
If you cover your face, you're protecting other people around you. We know now that people may be contagious before they have symptoms, or that people with coronavirus may get only mildly sick. You could be one of those people. I could be one of those people.
The recommendation on masks came first from California yesterday and today from the CDC after a study identifying RNA clinging to the air inside the rooms of coronavirus patients.
If all of us were to wear protective coverings of our mouth and nose, it's not that we would be protected from others, but others would be protected from us. And if we're all in this together and we all wear those kind of coverings, we stand a good chance of interrupting some frequency of the unknowing transmission.
Around San Francisco today, there were more masks worn than usual, even as people waited outside Safeway. Lewis Miller picked up his this morning at an Ace Hardware for $40.
And I feel that we need to keep ourselves safe and protected. This is not a joke. I mean, we're lucky. This isn't New York.
Wearing masks is still just a recommendation and not a requirement.
I'm keeping my 6 feet distance and not going into crowded areas. And with the mask, you end up touching the mask, you end up touching this, you end up taking the mask off.
Dr. Susan Phillip from the San Francisco Department of Public Health says you do not need an N95 mask, just something to cover your nose and mouth.
Made-at-home cloth mask, a bandana, a towel, a scarf, anything that will absorb droplets is just fine.
Now, public health officials say this cannot be repeated enough. You do not need an N95 mask outside. They do not want people rushing out to buy those. Those are already in short supply for first responders like nurses, doctors, respiratory therapists. They say covering your mouth with a cloth, something like this, will do the trick. You have stuff at home. They want you to start there before you start going after those supplies of heavy-duty masks. Live in San Francisco tonight, Andria Borba, KPIX5.